Infants' lives consist of several routines that provide a sense of comfort and predictability. Think about bath time, meal time, bedtime, and how each of those provides language learning opportunities. The textbook says caregivers often provide commentary to their infants during these times, similar to sports commentators when they talk during baseball or football games. If you've ever been to or watched on TV a baseball or football or any other type of sporting event, the commentators often provide a running string of thought about what is happening on the field. If nothing is happening on the field, they're giving stats and they're having conversation with each other. And that's often what caregivers do during these daily routines. Since these routines happen every day, the children are hearing the same words and phrases repeated each day. Caregiver responsiveness refers to the caregiver's attention and sensitivity to infants' vocalizations and communicative attempts. Caregiver attentiveness helps teach infants that other people value their behaviors and communicative attempts. When caregivers provide consistent responses, it promotes the child's ability and desire for joint attention and increase their child's motivation to communicate. Just like you and I, if you're talking to someone who doesn't really seem like they're interested in talking to you, it doesn't really make you want to talk to them anymore. The textbook has a list of characteristics of caregivers that improve the rates of language development in children on page 144. Things such as following the child's lead, using a variety of questions and labels, and encouraging turn taking. In infancy, we see important achievements in form, content, and use. Remember that form includes phonology, morphology, and syntax. In terms of phonology, we see them making sounds such as consonant vowel babbling. With regard to morphology and syntax, we don't really see any growth in these areas because they're not yet using language. Content, which includes semantics, is usually highlighted by their first word around 12 months. In order for it to be a true first word, it must have a clear intention, a recognizable production, and be used consistently. And we'll talk more about that in the next chapter. Use includes pragmatics, and while they're not having conversations, they are listening and observing how people are using language to communicate. They're also using a variety of pre-verbal language functions, such as attention seeking, requesting objects by pointing, requesting an action, such as holding up their arms when they want to be picked up, and greeting, such as waving, and they're also protesting. These next few slides are from the textbook, again, highlighting some of the milestones in content, form, and use, some of those achievements that we see. So for phonology, at 2 months, they're distinguishing their own language from non-native languages. By 8 months, they're discriminating native from non-native stress patterns. And by 11 months, they're no longer discriminating between two allophones. They're identifying words in speech that do not conform to the native language. So they are making gains in their phonological skills. This is for semantics. So at 2 months, they can briefly hold and inspect an object, and they start to mouth objects. At 8 months, they're looking in the correct place for objects that are out of sight. And by 11 months, they're able to understand some actions, they're able to produce their first word, and maybe even understand 5 to 10 words. And then here we have for pragmatic. So at birth, they prefer that infant-directed speech over adult-directed speech. At 6 months, they're engaging in joint attention. And then around 11 months, they're using their first true word. So the next few slides are milestones from the ASHA website. A milestone is a physical or behavioral skill that most children can do by a certain age. Milestones are often used as a guide for a child's growth and development. They're often used by parents and physicians to determine if their child is on track. There are milestones for communication. There's milestones for gross motor, such as crawling and walking, and things like fine motor, such as when they can use a pincher grip. If a child's not meeting the milestones, they may be referred to a speech-language pathologist because it may indicate a language disorder. These milestones from the ASHA website are when 75% of children can do these things. Some milestones are at 50% of what children can do, so it's always important when you're looking at milestones to know what it represents. In your resources, I have included milestones from the CDC website. These can slightly differ, but they're usually pretty similar. The CDC website also has videos to show what the milestones look like, so I'd highly recommend watching them. So here we see the milestone for birth to 3 months. Babies are alerting to sounds, they're starting to coo, they're turning and looking towards the voices of people talking. For 4 to 6 months, we start to see them giggle and laugh, respond to facial expressions, blow those raspberries that we talked about, react to toys. 7 to 9 months, they're looking at you when you call their name, they're starting to babble. They're looking for their loved ones when they're upset, they raise their arms to be picked up, and they're pushing away things that they don't want. And then 10 to 12 months, we see them reaching for objects, pointing, waving, showing, giving. We see them enjoying dancing, and we start to see them saying words like mama, dada, hi, and bye. Although infants develop language in a fairly predictable pattern, because they meet certain milestones in the same order at about the same age, some aspects of their language development vary. An intra-individual difference is a difference within a single child. For language, this means they develop aspects of language not at the same rate, such as receptive and expressive language. By age 1, a child usually can understand about 80 words, but they may only produce about 10. Inter-individual differences are differences within a group of children. Some children will develop language more quickly than others. Some children understand 15 words at age 1, and some understand 150. Both of these are within a normal range. Some children express themselves for different communicative purposes. Expressive language learners use language primarily for social exchanges, whereas a referential language learner uses language primarily to refer to people or objects. So an expressive language learner, their common first words might be hi or bye, whereas a referential language learner, their common first words might be ball or doggy. There are many methods available for measuring language development for both researchers and clinicians. I'm not really going to focus on the methods for research, but they are in your textbook. What is more applicable is how clinicians measure language. Clinicians will use informal language screeners and parent report measures. Informal language screeners are checklists of common early language milestones that clinicians or parents can use to check off whether or not an infant exhibits each behavior in question. Parent report measures include specific language behaviors that the parent report. Because parents spend more time with their children than anyone else, they are well positioned to report on their child's language behaviors.